While doing some research, I found these statistics. In 2018, 1 in 5 adults experienced mental illness. The average delay time between getting mental illness symptoms and the actual diagnosis is almost 11 years. High school students with depressive symptoms are twice as likely to drop out of high school. Depression is the leading cause of disability worldwide. Suicide is the second leading cause of death in 10 to 34-year-olds in the U.S. 41% of Veterans Health Administration patients have a diagnosed mental illness or substance abuse disorder. These are some of the many reasons that psychedelics should be used for medicinal purposes. Today we're going to discuss that there's a need out there for mental illness patients, that there could be a solution to their problem within psychedelics, and that there are many, many benefits to psychedelics. Aristotle once said, "It is during our darkest moments that we must focus to see the light." These darkest moments affect anyone and everyone: your mom, your dad, veterans, teens, your teachers, and so many more people in your life. There are many, many types of mental illnesses. Some of the biggest ones include anxiety, depression, OCD, PTSD. 1 in 7 people globally have 1 or more mental or substance abuse disorders. Dr. Gabor Mate, who is a Canadian doctor who's worked as a speaker for the Multidisciplinary Association for Psychedelic Studies, states, "The issue of psychedelic healing goes into the very heart of what it means to have an illness in the first place. How could a mental illness be effectively treated? Well, that solution is psychedelics. Psychedelics were used all the way back in ancient times for medicinal purposes. It gained a lot of popularity in the US during the hippie movement. However, prohibitive legislation was passed in the mid-1960s, and this ended all of the research at the time. Research began roughly 25 years later in Germany, and it has continued ever since. Now, there is a procedure to using psychedelics, and it really depends on what psychiatrist you go to, but this procedure I'm going to talk about is one of the more general procedures. First, there's going to be a preparatory meeting so that the patient knows what they're getting into. And then, when they go to their session, they're going to be injected with the psychedelic. The most popular one is psilocybin, and that is because it affects 2 areas in the brain: the amygdala, which is involved in how we process emotions such as fear and anxiety, and the default mode network, which is a group of different brain regions that are active while we sleep. After you get injected with the psychedelic, you lay down with your doctor or psychiatrist, and they're going to be right next to you while the drug is going through your system. The doctor is there to hold your hand and talk you through the trip if you want. The brain is going to be scanned during this for research purposes, and the type of psychedelic used during this procedure really depends on what mental disorder the patient has. For example, patients with PTSD are most likely to use the psychedelic MDMA, and that is because it has shown the best results in patients with PTSD. Did you know that a brain on psilocybin has the resemblance to that of a brain of an experienced meditator during a deep meditation? This is one of the many benefits that psychedelic therapy gives us. Here are some other benefits. It creates more of a positive mood for you. Psychedelic molecules are incredibly similar to serotonin. This means that both of these molecules fit into the exact same brain receptor, which will ultimately improve your mood. It also makes the patients feel more socially connected. It helps them release held traumas. It also, majority of the patients do say they have a better outlook on life. In 19 psychedelic research studies done from 1949 to 1973, 79% of those patients showed clinical improvement. Dr. Johnson performed a study on long-term chronic tobacco smokers in 2014. He gave them 3 doses of psilocybin and offered 4 therapy sessions. After 6 months, 80% of those patients were abstinent from smoking. Psychedelic research doesn't have to have a negative connotation with it. It is your friends, your family, neighbors, veterans, the homeless, the elderly, and many more seeking help for their mental illness in this eye-opening new way. To conclude, there is a need out there. There's a need for all types of people with all types of mental illnesses. I'm giving a solution. This solution is psychedelic therapy. And psychedelic therapy offers many, many benefits, such as an overall improved mood, and there are so many others. Now, if we want to legalize psychedelics for medicinal purposes, there are two key things that have to be done first. The black market for psychedelics needs to be eliminated, and this just ensures that the drug is going to be safe by only being offered in a medical environment. The second thing is that doctors and psychiatrists have to be trained and licensed to perform the psychedelic therapy, and this makes sure that those doctors and psychiatrists know how to guide their patient through a trip if that patient wants the assistance. This is just a big overall safety issue for that patient. Mike Pollan at The New Yorker interviewed patients using psychedelics during research trials. The first woman's name was Deborah Ames. She was an elderly breast cancer survivor, and she was a user of psychedelics for therapy. She described her trip like she was zipping through space, and then she arrived at the crematorium, and she was frightened because she realized that she was about to die and be cremated. But then all of a sudden, she was in the middle of this lush green forest surrounded by trees. And she is with those trees, and she is a part of them. And after her trip, she felt very content. And she said that her death meant that she wasn't actually gone from this earth, but she was left to be a part of it. Another patient, Tammy Burgess, was diagnosed with ovarian cancer at age 55. She described her trip as she was gazing across a plane of consciousness, and it was very serene and beautiful, but she felt alone. But she could reach out and touch anybody that she had ever known. She knew that once she died, that this is what her life was going to be like, and she was okay with that.